We recently had a question from a community member. What is lymphedema and how does it relate to chronic wounds?
So lymphatic system is the system that carries the extra fluid from the extremities down to, upwards towards your heart, and then it becomes it merges in the chest with your venous system. So you're returning the proteins, returning extra fluid back to your heart. Now, lymphedema is usually something we see either as a result of surgery. Most commonly, we as wound care professionals see lymphedema as an end result of very sophisticated circulation problem in the legs, and that leads to extreme leg swelling.
And are there early signs that caregivers or the patient should be on the lookout for?
Yeah, so when the wound drains out of proportion, so when we see patients who have really just a small, pinpoint wound, and as patient waits in the waiting room, you see a drip on the floor, drip, drip, drip. That's very, very significant. That's an extreme case that I described to you. But anything that's just the amount of drainage from the leg ulcer that doesn't correspond to the size and the depth of the wound makes you think of lymphedema.
And are there more effective treatments or management strategies that people should be aware of?
Yeah, so I think we should think of tighter compression therapy. If arterial circulation allows, we can do a quick ultrasound test in the office or at the bedside of a nursing home to check for arterial circulation. And given that the ultrasound test is normal, we can up the compression therapy, so we can compress those blood vessels, pushing them into a normal shape, and bringing that fluid back to your heart rather than it staying in the legs and causing the wounds that not heal. And by the way, they're also highest risk for infection. So these the wounds that we need to attend very, very thoroughly.
Great. And if anybody out in the community would like to submit a question that we can answer in a future video, please do so.